What's up, guys? Alex Wallace here from Wallace Training Systems, and this is episode 1 of the Powerlifting Project. We are traveling to North Apollo today to the Rehab Centre, where we're going to interview Dr. Isaac Greeley. Isaac Greeley is a chiropractor, but before he was a chiropractor, he was a standout athlete in the sport of wrestling. So he was a 2-time state place winner in the state of Pennsylvania, where he got a scholarship to go to University of Pitt Johnstown. At UPJ, he was a 2-time All-American, and he helped his team win 2 national titles. So he's a bona fide athlete, and that's why I wanted to interview him today. Right after he graduated from college, he went to chiropractic college. In 2002 is when he graduated, and he's been a chiropractor ever since. He works with the general population. Obviously, I work with the general population too, but he also works with a lot of athletes. He has worked with and actually trained MMA fighters, professional MMA fighters. He works with Jiu Jitsu guys. He works with a ton of wrestlers. And he also works with a lot of weightlifters. And obviously, that's why I'm going to see him. That's why I'm interviewing him. So we're going to start out with some general questions about chiropractic care in general. And then we're going to get a little more specific to weightlifting and even more specific to my lower back pathology, whatever's going on there. And afterwards, I'm going to get a little bit of treatment, and hopefully this information is not only valuable to you, but it helps me perform my best on the platform. So again, guys, I hope you find it informative. If you do, make sure you like the video. If you're interested in following the Powerlifting Project, make sure you subscribe. So first, I want to touch on chiropractic care in general. I have medical doctors, physician's assistants, people that train at my facility, and they're apprehensive about chiropractic care. I'm not sure why. I worked here for 2 years. I see that it's efficacious. I've seen people walk in with pain and walk out without pain. Why do you think that in the medical community, the chiropractic profession is almost seen as that third rail that people don't really want to talk about, or they just don't understand the efficacious nature of it?
I think that the biggest thing is education. I think that the education that a medical doctor receives compared to what a chiropractor receives varies in a lot of the philosophy behind it. Yeah. Chiropractic care is mainly rooted in prevention, maintenance, also getting to the root of the problem, trying to address it biomechanically. We specialize in musculoskeletal system. So a lot of medical doctors, get thrown off by that because their education tells them what's prescribed medication at first that's going to at least give the body a chance to recover in an amount of time. If that doesn't work, we look down the road for possible surgeries or other ways around it. My job as a chiropractor is to try to avoid that altogether. So a lot of times we're a last resort when really we should be a first resort. Right. Now I have seen a lot of that change in the last decade. I treat a lot of medical doctors almost every day. I have family physicians, anesthesiologists, pediatric doctors. I see a lot of different medical doctors that have bought into what we do because they see the results with patients that they treat. Yeah. So I think that stigma is dying down a lot. Good. And I think every chiropractor has their own philosophy. Some of it might not be in line with what a medical philosophy is. I think the type of practice that I run is more in line with the medical dialogue, because I can kind of relate to a strain. Like, I'm going to treat that strain with some physical therapy, with some massage therapy, with some chiropractic treatment, with some stretching, with some exercises. They can kind of see, like, okay, that would probably be around the realm that we would think that would help the patient. So I think we do have some common ground as well.
I think that's an important point, that oftentimes people think when you go to a chiropractor, you just get adjusted. So I know that it's more than that, but when somebody walks into the Rehab Center specifically, or a chiropractic care in general, what are the treatment options that they have?
Well, it's such a wide array of techniques that are involved with chiropractic. Yeah. And the one thing that all the doctors at the Rehab Center, we have 6 locations with 6 different doctors, but we all have the same philosophy, which makes it really nice. Each of our doctors was not only trained and licensed as a chiropractor, we also have physiotherapy licenses, which means we had to do extensive training on physical therapy modalities, passive and active. And that we kind of incorporate that into our scope of practice that we do at our offices. So a lot of chiropractors, we have what's called a straight chiropractic. That chiropractor just thinks that adjusting is the only thing that's necessary. And in certain instances, I believe that's very viable, and I do just adjust people sometimes. I think that's the answer. But other times, I would either recommend physical therapy at a different facility with a physical therapist, or I will actually put the patient through some exercises like you saw me do when you got here today. So we'll actually incorporate that in their treatment plan as well, depending on the severity of the situation, the condition of our patient or athlete. But most of it, the most important thing is to give the patient something to do at home. Make sure they're doing homework, because if I only see them 1 or 2 days a week and they're not doing that homework, the result's going to, kind of be depicted by that.
Yeah, so you have basically things that will help alleviate pain, change dysfunctional movement patterns, but you need to reinforce it with things like, okay.
Yeah. So big belief system that we have in our practices. And, some chiropractors, dive into that even more than we do. I think we consider ourselves a diversified practitioner, which means I diversify my treatments based on what I think is necessary per patient. I don't just, some chiropractors might say, hey, we do C1 adjustments and that's it, that's going to fix everything. Our philosophy and our beliefs that, hey, if that's the case, yes, but there might be more to it. We might have to add exercise, passive, ultrasound, cold laser, decompression therapy to help aid the patient to heal faster. And it just feels, whatever we feel is right with the patient. And the biggest thing that separates us, I think, from other chiropractors and even the medical field, mostly and specifically, is we look for feedback from the patient. The patient understands his body, his reactions, his healing better than I do. So if I see right off the bat that something's not working and the patient's communicating that with me, like, hey, this isn't really helping, I like to have other options and other avenues in place that I can say, okay, let's try this. Let's go into this protocol a little bit more, since this isn't really getting the result that we want. But it's based on your feedback. We're working as a team here with the other doctors and the therapists that work with us. So I think with that mentality, we get a little bit better result because we can jump on what's working faster.
Okay. So who do you think should come in and see your chiropractor? Like, what would be a telltale sign for somebody to be like, I need to go see a chiropractor versus I need to go see, you know what I mean? Like my MD or whatever.
I personally preach a lifestyle of chiropractic. It's a lifestyle. And a lot of people are kind of shy away from it. Like, I don't want to go to a chiropractor because I'll always have to go to a chiropractor and I didn't sign I get that a lot. But realistically, it's a lifestyle. My life was changed when I was 14 years old when I got tackled in junior high football and I couldn't tie my shoes for 2 to 3 weeks. I went to my medical doctor, who was my family physician, friends of the family, prescribed me a medication, kind of dulled the pain. I played through it. Got to the end of the season, I still had the dysfunction, still couldn't tie my shoes. The pain came back, and my mom ended up taking me to a chiropractor who took an x-ray, assessed me, and I could see it all kind of unfolding, and I'm like, if this works, I'm going to be very impressed with this profession. Well, after 2 or 3 adjustments, the pain went away, I could tie my shoes. I was sold on chiropractic at that moment because I actually had a real life situation that I could relate to. And then from that day on, I'm like, this is really intriguing to me. So I started having interest in chiropractic at that moment. The other thing my mom decided to do is like, why don't we just take you to get adjusted once a month to make sure this doesn't happen again? You're obviously very active and you're going to have issues. So I think with my parents kind of reinforcing that, like, hey, nothing's bothering you, let's just go get things checked out. I started getting maintenance adjustments, and then when something did pop up, it seemed like my chiropractor could assess it quickly, get on it faster. I healed faster. I really didn't have a lot of problems. I didn't have many injuries or even illnesses from that point on my life on. Which really kind of like made me think even more about it, and that's kind of what led me into the field of chiropractic. I had a few other key situations kind of push me and validify that for me, but I think that everyone can go to a chiropractor. It's not going to hurt anybody. There's different techniques. There's low force techniques for elderly patients, for babies, for kids. There's stretching techniques that are the people that don't like hearing the cracking noise. There's techniques that we use mainly just stretching of the myofascial tissue, which is very helpful and beneficial in its own way. The key to chiropractic is movement. Okay, so obviously when we get older, our health is reliant on how well we're moving. I treat 60-year-olds that worked in coal mines their whole life that come in to see me, and the movement in their body is very, very diminished. So for me, I have a lot of work to do to get that movement back, okay? So in those instances, like patients like that, we're pretty aggressive on treating them. Now, other people that are staying active, that do yoga, that weight lift, that that walk, that kayak, that are outside, those patients are already addressing that by themselves. So it's a little bit easier for me to guide them. I might not see them as often. So I think everyone has a place for chiropractic. I just think it depends on the situation. Your lifestyle is a big part of it. Your prior, history with your job and whatnot is very important as well.
Yeah. Okay. Perfect. So just following that vein, I know that you said that you were changed basically when you were an athlete, you got injured, Chiropractic Care helped you a lot. I want to talk specifically about people who lift weights. I'm getting ready. I have a powerlifting meet coming up September 28th. I want to make sure that I stay as healthy as I can over the course of that prep. Or if I do get injured, I have the resources necessary to keep me on the platform so I can hopefully hit some pretty big numbers. So what are some common injuries that you see in people who lift weights that they would need to come and see a chiropractor for?
I treat a lot of weightlifters, competitive weightlifters as well. I see very similar injuries with most of them. So what we focus on mainly, our number one focus is joint. Okay, so with the joint, there's a lot of different ways to injure the joint. You can strain the joint, you can cause irritation to the joint, there can be inflammation around the joint, there's different things that can happen. When you're getting ready for meets, it's very important to have what we talked about is a strong kinetic chain. If there's a kink in the chain, your body's going to compensate for it, but it's going to end up eventually causing a breakdown. The most common one that I see is a sacroiliac strain. That's a joint in your low back. It's where the dimples are on each side of your low back, and it's a big joint. So the bigger the joint, the easier it is to injure. So your low back, usually the joints are smaller, the facets are smaller. It's a little bit more specific movements that it would take to cause an injury to the facet joint. Now the SI joints are bigger, so it's going to be a little bit more dynamic movements that would cause injury. So usually I see that with deadlifts, with snatches, with cleans, where they're actually using explosive movement. They're going to load the SI joint more, and you can start irritating it. There's also the fact that you can go bone on bone there because it's the ilium and the sacrum can rub. So you start getting that irritation, it's going to cause inflammation. Inflammation builds up in the joint. The patient's going to start feeling a little bit of an achiness to the low back, down low. They're going to wonder if they're not stretching enough, and it's really more just from the activity that they're doing with the lifting.
That might be something that I'm dealing with then, because I noticed that, I've been trying to push my weights up as much as I can. One thing that I notice is it's a dull ache in my lower back, but it's odd because let's say I'm picking up, it doesn't have to be heavy. Like I picked up a kid to put him on a pull-up bar, he's 53 pounds today. And it was like a weird, almost like shock in my back.
That's exactly what you're feeling. You're feeling the shear of the bone on bone. And that means you have dysfunction in the joint. The joint should glide like this. A joint should glide. So if there's dysfunction in a joint, it's going to wedge or it's going to grind. So even a little bit of dysfunction over time, it depends. It could be a small movement. It could be big movements. Usually the bigger movements are going to be the ones that cause like the longer term type achiness, but it doesn't matter if you have a little bit of that already and you're just doing little movements, it's going to irritate it as well. So that's probably one of the most common things that I see. The other thing I see a lot of are shoulder and elbow issues with power lifters. It's just because they're putting a lot of load on the joint and on the tendon. Tendonitis is very rampant. It's horrible. If you've ever experienced it, it can stop you dead in your tracks. So the easy ways to prevent that. Obviously, icing after lifting is a very important thing. If you're gonna lift very hard and heavy, even if you're gonna go beyond your normal load, you should always ice the joint just to make sure that inflammatory process is dulled right from the beginning. And stretching obviously is very important as well. Making sure you're properly stretched before and after you exercise, I think, is very important. We do a lot of it. We train Jiu Jitsu. We do a lot of stretching all the time, which will help prevent injury for that kind of thing as well.
Okay. So you just explaining my symptoms now, what would be a treatment plan that, let's say I would go through?
Very common. I just treated it today with the power lifter. Number one, first and foremost, would be to make sure we do drop technique on the SI joint, which we'd make sure that the joint was shearing properly. It's pretty easy to tell. It's a pretty easy assessment. We just check for shear on each joint, and usually you'll see one that's fixated, and then we're going to set the table into a drop mode and drop on the pelvis to get that shearing properly. I also like to, after I adjust the SI joint, I like to do some myofascial stretching with it. So we do a technique called flexion distraction. We use it almost every day, every visit almost in our practice. And it's a type of traction that we use to stretch not only the QL muscle in the low back, the ligaments that attach to the sacrum and the low back, also the myofascial tissue. With that type of release in the myofascial tissue, it's going to take a lot of pressure off your sacroiliac joint as well. Okay. So we always assess that. Sometimes we'll do a side posture adjustment depending if it's necessary, or a hip adjustment. And then I almost always would recommend either an ultrasound, which is a modality that removes inflammation. It almost acts like a vacuum cleaner. It's going to suck some of the inflammation out of the joint. And that's what's going to cause you that achiness. So even if it'll cause like an immediate release of the pain that you're having, is it going to fix the problem? No, but it's going to pull some of that out. That's going to make it a little bit more manageable for you as a patient. And then we always try to recommend either a hip stretch or pelvic tilting, just to help make sure the core is engaging, take pressure off as well. A little bit of just core engaging before you work out, before a lifting meet is very important to prevent injury as well. Yeah. So as long as we're telling the patient, like, hey, we're going to treat it, we're going to fix the problem, we're going to try to fix the problem. It might take one visit, it might take 3 or 4. We're going to see how you feel after each visit. But I want you to go into your meet feeling that you're 100% healthy. Right. That's always the goal, because psychologically, if you don't feel like you're at your best, you're not going to be at your best.
Absolutely. So I think that answered all of my questions. The last thing, where can we find you?
Rehab Centre. We have 6 offices in Western Pennsylvania. Dr. Ralph Petrarca started the practice 20-some years ago. My partner, Jason Jacobs, and I, Jason joined 19 years ago. I joined 17 years ago now. We now have Ralph's son, Anthony, that you grew up with, working with us, Dr. Derek Mason, and Dr. Matt Brush as well. We're in Clarion, Brookville, Katanning, Apollo, right where you're at today, Lower Borough, and the north side of Pittsburgh. So we're kind of in a straight line, and we're open to new patients at all times. So, we just want to, our goal, our motto is Chiropractors Caring for Health, because I really feel like we do care for people's health, and we really care. We have a family atmosphere in our practices. We know people by their first names. They know us. And it's a pretty special thing. It's a special profession. I'm very blessed to be a part of it.
Perfect. Awesome. Thank you very much.
Thanks, guys.
So some of the takeaways that I got from this interview is, number one, that chiropractic care isn't like just one thing. I noticed that a lot of people that are like, oh, I don't like chiropractic care, they only go and get the adjustment, which I'm not saying it doesn't work. I'm saying that does work. But if you don't have a place like the Rehab Center, there's a gym there. Like, we did the interview in the gym. Then maybe that's not the treatment for you. So what I like about the Rehab Center is, like, we walked in there and, like, people were exercising. Like, Isaac was taking a girl through exercises. So it's like one of those things that really meshes with our philosophy at Wallace Training Systems. Namely, you need to be active, you need to exercise. So that's a big thing that I think a lot of people misunderstand, is that a good chiropractor is going to have a lot of different modalities to help you recover from injuries. Another thing that I kind of take away from that is, like, for me specifically, I need to do some type of, obviously, rehabilitative work, whatever it's going to be on my low back, but also a little bit of maintenance work. Like, I'm going to be moving some big numbers, and in a lot of ways I already am moving some heavy weight, quote unquote, heavy for me at least. So maybe going there and just having somebody really understand my body, the different flaws with it, or the different things that we can help improve on, is going to help keep me on the platform. So like I said, guys, it was an informative discussion for me. I hope it was informative for you. This is definitely something that I'm going to be using on my prep for this powerlifting meet on September 28th to hopefully squat 600 pounds. So again, guys, if you found this informative, make sure you like the video and subscribe to the channel. If you have any other questions, just leave them in the comments, and I answer all the comments. So make sure you comment something if you have any questions, and thanks for watching.